after this one. Okay, so we now go to CPR. Okay, so what does CPR stands for? So cardiopulmonary resuscitation. Okay, this is also known as your BLS. Okay, sometimes we call it BLS. Okay, the basic life support. Okay, so remember, failure to institute ventilation, okay, within 4 to 6 minutes, okay, will result to cerebral anoxia in the patient, okay, and eventually brain damage, okay. So remember that it's important for you to start CPR within 4 to 6 minutes after the oxygen is cut off from the brain, right? Because brain can die easily, okay, within 4 to 6 minutes, okay. The brain tissue will die, okay, without oxygen, okay. So it's important to start CPR immediately, okay, so that you prevent these two complications, okay. Anoxia meaning A, no oxygen, okay, and okay, no oxygen to the brain, okay. Okay, so remember, cardiovascular disease is the #1 cause of death, right? It's not cancer, okay, so cardiovascular, okay. Sudden cardiac arrest occurs during 1 hour after the heart attack, okay, and more than 2/3 do not reach the hospital alive, okay. Imagine that, 2/3, about 66% will not be able to reach the hospital alive, okay. Death will follow unless emergency treatment is provided immediately, okay. And remember this, the most common cause of sudden cardiac arrest in an adult, okay, is what? Everybody read. Ventricular fibrillation, okay. So remember that. What does it mean? Okay? The ventricles are shivering like that, eh? The ventricles should contract all at the same time, right? All the muscles like that, right? So that blood will come out, right? But we say fibrillation, so it's just like shaking, okay? The muscles are shaking without effective pumping of the blood. So what happens with that? The blood will stay there, and then you will form clot, right? And then the clot can grow to the brain or to the heart, okay? So remember that, okay? So the most common cause is your ventricular fibrillation.